Well, hello and welcome to Wellness Wednesday. You may have noticed we might not have been available last week. We do apologize. I'm Deborah.
And I'm Rachel.
So we're here today. We're in March. We made
have.
it. So it's the St. Patrick's Day month.
Yes.
Make sure you wear green on the 17th.
And that falls on a Sunday.
Oh, good. We're safe.
So
We're safe.
everybody should be safe.
We should be okay.
Yeah.
I have a permanent green in mine.
Yeah.
So
Well, my eyes are green.
I
So
may have a thing on my foot that has green in it. So.
Oh, I probably do too.
We're gonna make this short and sweet today. It's Wednesday, but it's been a crazy week.
It has.
So just kind of visit a little bit. We're over at the assisted living today in the conference room.
Mm-hmm.
We don't have a guest with us today. I tried to get some of the aides, and they all of a sudden ran out of the room.
They did. They
Yeah,
ran out
a little
of
camera
the
shy. I told them we'd be nice. If they've watched our podcast, we haven't made anybody cry or anything.
Not yet.
Oh, mm-hmm.
Not yet.
So, I mean, it could be a good day for somebody to come in here and talk
It
to
could.
us, but that's okay.
Or maybe we could just flag somebody down.
We could just walk
I
around
call
with
it
it.
the fishbowl over here because it's all windows and
there's no
people
blinds.
watching as they come by. So
We
maybe,
get a little distracted.
just flag somebody down and make them come in unexpectedly.
I don't know about you, but have you been in the mode of spring cleaning? I have.
I have, and the
And it's
weather
driving me
is
crazy.
so nice. It's nice, but the pollen is bad.
Oh, yeah, we cleaned our patio off, and it's green today when I went home for to let the puppies out. And I was like, oh. So
Yes.
I've covered my furniture, so at least it'll save the cushions until I'm ready to uncovered after pollen. And I don't know what it is. I call them little worms. It's from a tree. They're
No,
everywhere.
yes.
They're squiggly. They look like worms.
At my house, it's the little white petals off of the trees, and the trees are so pretty.
They are.
But once they start that pollen stuff and those little leaves falling, then it's bad. I have my 3-year-old has, you can tell his allergies are
full
it's all
blown?
pollen. Yeah, he has a watery eyes and a little snotty nose, and yeah.
Well, I was at Post Acute yesterday, sitting under a pine tree, and I saw and pine trees are they get me. My eyes will swell up, especially if some wind hits it and you just see the yellow mist. And I'm like, no. And I parked right underneath it. And I'm like, and I came out and my car had a little bit of more yellow on it than normal. I was like, ugh.
It is the season of it, but it's also this coming weekend we spring forward, which I'm one of those that I prefer to fall back.
Oh yeah, that
I
extra
like to
hour.
fall back. I don't like the spring forward, but
Once you get used to it, it's okay. But it's that first month. Don't talk to me in the morning, please. I'm just giving you fair warning. It could be
it
detrimental.
would be better if we just settled on one or the other.
Well, I thought we
shouldn't have
were.
to pick.
At one point, they said it was going to stay spring forward, but then all of a sudden it didn't. So
And yesterday was an election voting thing in Texas.
three
yesterday.
now presidential candidates or nominees, narrowing it down, I guess you could say, because we will have an election this year for president in November. So stay tuned for all of that, because looks like it could be Biden and Trump again. So we all know how much fun that was when it was however many 4 years ago.
But on the upside, remember that portal I was talking about?
We're
Maybe
repeating it.
repeating, and maybe it's time we can shut it all down, and
Oh yeah, it did happen. Oh Lord,
Maybe.
Lord.
maybe.
Hopefully that won't be a recurring event, because that was not fun.
And Easter's coming. The Easter Bunny's on his
31st.
way. Get ready on the 31st. Easter is early this year, so
We'll actually be in some of the facilities. Won't say who will be the bunny, but we'll flip a coin that day, and you'll decide if it's the tall one or the shorter one who's in the bunny suit.
yeah.
So we try to be festive as we can be. So we'll be doing that in the next weeks coming up. Going out and spreading the bunny love with everyone. What else is going on? Just a little bit of this, a little bit of that.
Yeah, it has been rather busy for the past 2 weeks. That's why we didn't get to see you last week, because there's been a lot of things going on.
Our time got away
just,
from us.
Meeting with people and helping people in the community, but with the pollen season and the allergy season and more people getting out and getting about, going. Your spring cleaning. I had one afternoon of sitting in my yard thinking of all these things I wanted to plant in a garden and all that fun stuff. This is the time of year that some of our loved ones, or maybe us ourselves, that have asthma or already chronic lung conditions where this is the time of year that we see flare-ups.
Yes.
So if you are one of those people and you know that, the season does that, now is the time to start your preventative medication. And if you're an asthmatic or a COPD, you know what those are.
Oh, yes.
There's peak flow meters that some people use to, if they do it correctly, they work very well. You breathe in those in the morning in the correct way, and it'll tell you, if we're in the green zone, yellow zone, or red zone. So now is the time to start using those. But it's also, this is the time of year that our home health can come in and help you.
Absolutely.
So, if you are struggling with your breathing because of the pollen, or just because when the seasons change, the humidity and everything changes.
Ooh,
And that
yes.
all plays a factor into
We
it.
live in East Texas, and we all know what the humidity factor is in in the South.
So I live with an asthmatic person, and we can pretty much put it on the calendar. September and April are our red flag months that we know that we're more than likely going to have a flare up. So
Be
we
prepared.
are also a teenager and non-compliant with our medicine as it is now, unless I'm completely, have you taken it? Have you taken it? Have you taken it? So
The bad mom is pressuring him to do it.
if kids have the problem, then I know adults have it. So
Absolutely.
this is your time of year to be proactive. I know we have
Get on
been
top
talking
of
about
it.
that, but take those preventative meds. Don't skip those inhalers. If it's not an inhaler and it's a nebulizer, do those. Stay ahead of the
See your
game.
PCP. If you have med changes, things like that, because that can affect you also if they add a medicine to you. Sometimes you may have a different reaction to that medicine, and that's when you need home health in the home to be proactive with you, so they're monitoring and seeing it. Because you go see your doctor, it's one thing, but if you have somebody come into your home at least once a week, for just one certain period, that can get you leveled off, and those if meds need to be changed again, then they're there to do it with your doctor. They make a phone call and say, hey, this is what's going on, what are your recommendations, and they'll take care of it for you, which is nice.
And because it's warmer, and like I said, you were talking about spring cleaning, and I'm talking about
flower beds and everything,
plants and things like that. Maybe you want to do those things, but you've set all winter long, and you
not as strong as you were.
You've got some weakness, and you can still do it, and you're trying to get back to that. Go see your doctor. Go see your doctor. Tell him what's going on. Hey, I want to be able to.
I need some therapy to strengthen and show me some
therapy.
exercise.
And our therapists can come right out in your home and help you, and even go outside.
Walk with you outside, show you some techniques on how to get up and get down. Which I didn't really understand that, but as I've gotten more into it, the OT is really good about. Like if you're going to take a shower, giving you safe ways to do it. I know we've done it all our life, but as you get older, you need a more precautious way, and they actually have those. I mean, they can actually teach you different methods. Look at your home environment, your outside environment. You may need this, and they'll make recommendations, and go through your physician to get those for you. If it's grab bar going in and out of your house, out of your home, in your bathroom, those type of things.
And that's also something that we can help with anyway. If you are trying to accommodate a family member or yourself, and you're trying to figure out what your home needs, our therapists have gone out and done safety evals for people, and they can give you recommendations on stuff. So that's always an option too. All you have to do is call the office, and they'll get with me or Deb, and we can help to get that set up for you.
It's a handy little thing to have.
It is.
I think. I wish I'd known more about this when my parents were with me, because I probably would have had something come in. Because
you don't really ever think about it until something is
until it occurs. Yeah. I mean, we all want to be independent, 100%. But we get to a point that we need a little bit of help. Why not get it when you can? And easy steps.
You don't think about it, but the height of chairs, of couches, recliners, it may seem, like very usable furniture for everybody else. But if you have somebody that already has a hard time getting up and down, they can get in chairs and not be able to get back up. They can get on a toilet and not be able
It's
to
kind
get
of like
back
me
up.
getting on the ground. I don't always know if I'm going to get back
yeah,
up. So
yeah.
I've had to learn techniques on how to get back up off the floor.
And it's like that workout, like that. I say that because it's not very often that I actually participate in a workout, but the few times that I have, when you do that initial workout, you're feeling all great about
I got
it,
this.
and then
The next morning?
day, the next morning you get up and
Your body reminds you're not in
You
shape.
get up to go to the restroom, and then let's get the day started. But making that first rise off of the toilet is wow, what happened?
You're screaming, because it hurts. Every muscle in your body goes, hello, why haven't you been doing this? Why did you start now? Let me remind you.
Yeah.
That's always a rude awakening.
It's a real deal for sure. There's I'm so out of shape at this point. I scrubbed and did my baseboards and stuff. I guess last weekend and Sunday when I got up to get everybody together and started picking up, I'm like, why am I so sore? That's why.
We power washed our patio off, and there's this circular thing that you clean with. That thing beat me up. I was like, got up Sunday going, what's wrong with me? He goes, you did that outside. And I go, oh, okay, but that wasn't that bad. It was.
And I touched on home health and how we can help with those people that, like our seasonal time. But this is also the time with hospice that you see people who are COPD people with those chronic lung conditions, that they tend to have a flare up too. And a lot of times this is the time that we see an increase in revocations on hospice if we're already very anxious and we've waited too long to call our
You think you could
hospice
get it under
agency
control, yeah.
and say, I'm not feeling so great. We might have waited too long, and then, we're going to panic and call 911, which everybody's human, but we have the inpatient unit, and it is open to all hospice agencies. So
just need a contract with us.
You just need a contract. Our patients, most all of them know that unit is open and available to them, but maybe you have somebody on hospice now and you've been watching us, and this is the time of year that we see people panic and come off, and it's because a lot of times we wait too late, or we've done everything we can at home and we can't get it under control, and then we're
the reaction is to go to the
Yeah.
emergency room. But the truth of the matter of that is, you're going to go to the emergency room. You're going to stay there in the emergency room for from what I understand, the emergency room is pretty packed these days. You could be in the emergency room for 10 to 12 hours, and it recently just happened. So I don't know about you, but no, thank you. No, thank you.
Especially if you're not feeling good.
And they're going to take the priority, which is they need to see blood or active heart attack or something like that. Anything in between, it kind of gets pushed. It's by priority.
Yeah.
Not breathing is a pretty major priority, but again, could take up to 12. I've seen it take a long time in the emergency room.
So
we did have another hospice on our pod. No, we had another hospice in our unit. Went really well, and we hope to have her on our podcast soon to talk about how it went, and would you recommend it to other hospices? Of course, I know that they would, and we're excited that they're utilizing it. Our goal is to help the community. It doesn't matter what hospice you're on. It matters that you're taken care of and your family's taken care of. That's our goal.
Yeah,
So,
and to keep you out of the hospital.
Right.
If hospice is what you've elected to do, and you want to be managed at home, and going to the unit may not sound like the best thing, but when you compare that to not wanting to be in the hospital or the ER, or
the way
you have options.
The way you have to look at the unit, and this is the way I describe it to people, it is a hospital for hospice patients. They're hospice minded, meaning they're going to make you comfortable. They cannot cure you, which, and you go into the ER, they're not going to cure you. So why wouldn't you want to go to a unit that's going to take care of what's going on with you, make you more comfortable, and hopefully send you back home?
Yeah.
And that's
get those symptoms under control. Get your breathing, your airway feeling like you're not sucking through a straw, or you're not having to lean over and tripod on something to
the-
catch your breath.
The pain's out of control.
Mhm.
We've taken everything you know to take. The nurse has been out I don't know how many times. It's just not working.
Yeah.
The beautiful thing about here is you don't have to wait for an ambulance.
Right.
We have our own non-emergency transport that'll bring you right into the unit. The nurses will go into the room. You'll go into the room that you're going into. They'll do whatever they need to do in there, make med adjustments, call the medical director and all that. And it'll be taken care of within, I'd say, 20 minutes of you getting here.
Yeah, we have
20,
actually a Saturday morning. You remember we were actually working a parade, and I had
yeah.
somebody call me on a Saturday morning. A family member that was panicked. I don't know what I should do. Should I call an ambulance? Should y'all come out? So just within, that one conversation, we had figured out mom did not want to go to the hospital. That's why she elected to go on hospice. Daughter's panicked. We were able to have our transportation out and have that, patient back to the unit within that 30 minutes of that phone call. And, we got our symptoms under control and everybody was happy and, she got what she needed without having to go into the hospital and, that's what
That's the whole goal of the unit. You
That's
do
what
have to
it's
be a
about.
hospice patient. We're not aggressive treatment. And that's what the hospital is. If you're on hospice, you already know it's not going to be
Yeah.
cured.
Yeah.
So the goal is to make you comfortable, and that could be with just different med changes, adjustments, breathing treatments, things like that. That doesn't mean that we're not going to take care of what's going on.
Right.
We will, absolutely. But they're focused on hospice, and they know hospice, and they know how to treat it.
We do. A good example is if you have breathing problems, you're a COPDer, and you do albuterol breathing treatments, okay? A lot of times we start the treatment, we get into it 5-10 minutes. Oh, I've got some relief. We don't want this thing on our face. We take it off and we lay it down. 20-30 minutes
You go back into
because
that.
we didn't finish that. We go back and
into
we start it
distress.
again.
Mhm.
Okay, so we do that cycle off and on, and then we get to where that's what we're doing. We're on and off of the nebulizer because it brings us a little bit of relief. But we've also done a whole lot of breathing treatments. So now we have the shakes. We're clammy. Our heart rate is high. Our anxiety is
Out
up
the
here
roof.
now
Mhm.
because we already have a high heart rate and we feel like we can't breathe. So hospice nurses know how to assess people and
Make those
medications that we
adjustments,
can do. There are different breathing treatments that we can offer that will, get your airway open back up, but not cause your heart rate to be high. They're hospice minded and they're comfort minded. So, when we bring you in and get you started on that, yes, we're going to do everything we can to get you feeling better on your breathing. We know eventually it's going to probably happen again because it's a cycle, but you're still getting what you need without having to go sit
To
in
the
the ER
ER.
and do all that. Yeah, but
But anyway, we just want to jump on here real quick today and kind of share a little bit. We got a lot going on this month. We'll have more guests coming up very soon. I've actually reached out to Area Aging, spoke with Vaughn today. I think she's going to try to be a guest with us, so we look forward to that. But we hope you have a great rest of your week. Just try to make it through this pollen season best you can.
Yeah.
Go see your physician
stock
if you
up on
need to.
those over the counters
Right,
now.
right.
Take your, Claritin and Zyrtec. Those are the ones that help. We actually we have been spotted by a patient family member to come in to talk to us, and
So we're gonna jump off of here real quick. Have a blessed rest of your week. I'm Deborah.
and I'm Rachel.
Talk to you next Wednesday.
Bye.
Bye.
Choose excellence in healthcare. Choose Retreat Healthcare Services.